Test 1, 2, 3, 4. All right.
Good morning, good morning.
That's a pet peeve of mine, we don't do much.
We know.
You know, it helps to see the light.
That's right. So Charlie has seen the light. Yeah.
Well, we're working on it.
That's where that term came from, Charlie. I've seen the light. That's what it is.
Is yours on?
Not right now.
Now it is.
There you go.
Now it is.
Good thing Troy noticed it, or what's your name today?
Yeah. I'll be Troy. That's fine.
Give me some Van Dusen shirts and some Commissioner Van Dusen.
Yeah.
Yep.
My name is name tag.
Good morning. Morning. See when we get out of the office. Did the wind come up? That mess your hair up? Or? No, anything messed up. What's left of it anyway.
Jim, after reading this form, I have a better appreciation for what you do.
Yeah. Nothing's free.
Kelly. No free lunches, right? Speaking of lunches, what's on the menu tonight?
Is he giving you a tour?
Can't beat
Have
that.
you gotten a tour
Life
of
is
the,
good.
where the barn where have you gotten a tour? Keeps the equipment.
Jim, will you be at that pod exercise all day on Thursday? What time does that start?
That's a nice little barn.
Well, it's what's
They went up to the airport
yeah. What's amazing is
Okay.
a couple years ago when the president was
okay.
I told her
yeah,
I'd
what's
be there.
amazing though is that
I said I told her I would
yeah,
be
what's
there,
amazing though is
just
we didn't pay for any of that
because
stuff. He gets it through.
I guess
We paid very
I'm on the
little.
list, but it's really nothing for me to be there for, but
This has got a lot
I thought I should go once. Okay. I have 9 a.m. Okay.
Good morning, everyone. It's 9 a.m. It's time for us to convene our October 24th Catalina County Commission meeting. We'll begin the meeting with the salute to the flag. And Charlie, would you lead us this morning? Thank you.
I'll try.
Little housekeeping before we get started. If you have a cell phone, please silence it or turn it off. And if you do get a call that you absolutely need to take, please step out into the rotunda and take the call so you don't disrupt the individuals that are speaking at that particular time. Also, we are being streamed live, so if you address the commission, more than likely you will be streamed live, and just so you know about it, so there's no surprises.
I'll make a motion to approve the agenda.
With that being said, I'll entertain a motion to accept the agenda. I have a motion from Commissioner Hatton, a second from Charlie Waterman. Any discussion? Seeing none, all in favor indicate by saying aye.
Aye.
All same sign, motion carries. Action to approve the minutes
Move
of
to
the
approve
October
his email.
17th meeting. Motion by Hatton, second by Van Dusen. Any discussion? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed, same sign, motion carries. Number 4 is a discussion with representative from Sanford Profile Diet Plan, and Brittany is here. And so Brittany is going to give us her presentation, and oh, she's gonna talk about diet and start us off with a Snickers candy bar. I think that sounds like my kind of a diet.
Treats, right? So,
Doesn't look like a Snickers though.
oh, it's chocolate.
Oh, yeah, there we go.
So I'm just handing you out one of our profile bars and some information on profile and what an employee partnership looks like. So today I'm here to talk to you about.
Hang on a second, we need you on the microphone.
Okay.
Yeah, pick that up if you would.
And if you tell us who you are and who you represent, so that we get it in the live stream, that'd be great. Okay, thank you, Brittany.
There you go.
Okay, my name is Brittany. I'm here with Profile by Sanford. I am the new manager. I just stepped into this role in September. Actually new to the community, so it's all nice to meet you. I'm here today to talk to you a little bit about who Profile by Sanford is, where we've been, where we're going, and what an employee partnership could look like to you. So Profile by Sanford is a direct line off of Sanford Health. And so all of our protocols that we make, all of our diet plans, were actually made by Sanford researchers, physicians, as well as dietitians. We have a clinical advisory board of these dietitians, researchers, and physicians that made our initial protocols, and they continue to meet annually so we can upgrade our plans based off the newest nutrition research. So, for example, the RDA guidelines for caffeine said that we could have 2 cups of coffee a day, and they actually bumped that up to 4. So that's just a change in one of our protocols that we carry out here. But really, I'm here to get down to what an employee partnership would look like. An employee partnership is of no cost to any business that wants to be engaged in Profile. Brookings County, I used to work for the Brookings Profile, is actually an employee partner. So what this means is that you are able to offer all of your county employees half off of memberships as well as 20% off of product. And I'll tell you a little bit about the plan. So when somebody comes into Profile, we look at their medical and lifestyle history and make a plan based upon that. We have different protocols. So we have a mom protocol for nursing or pregnant mothers. We have a teen protocol, an athletic line, a protocol especially made for people with different medical and lifestyle considerations, and our most common Reboot Reduce protocol for weight loss. Our certified profile coaches, most of us have a bachelor's degree or higher, and we are able to carry out these protocols in our coaching appointments. So why did Sanford see a need for a weight loss program? And the answer is because 66% of Americans fall into the category of overweight, obese, or higher. And this directly translates into 35% of Americans having metabolic syndrome. This is going to include high blood pressure, cholesterol, heart disease, things like that. And so with that directly correlates into our workforce, right? So obese individuals actually spend about 47% more annually on healthcare costs and about 87% more annually on pharmaceutical costs. So directly correlates. What I'm here today to talk to you about is what you can do about that. So being an employer partner costs nothing to the employee. It gives you half off that membership, like I said. A general membership is $300 a year for a member at Profile, and that gives them a SMART scale. So the scale that they receive measures body fat percentage, muscle percentage, bone density, hydration levels, and basal metabolic rate. It also ensures the coaching. The coaching is something that we really pride ourselves about at Profile because we focus on nutrition, activity, and lifestyle. Our goal is to give our members the tools so they can make healthy lifestyle changes on their own. So when I think about this, I think about you give a man a fish, he eats for a day. You teach a man fish, he eats for a lifetime. If I tell one of my members in my coaching appointments what to do, this, what to eat, that doesn't teach them anything for when they're maintaining their weight loss, right? So what we do as coaches in our coaching appointments is we focus on nutrition label reading. We show them how to pick something out at the grocery store. What kind of swaps can you make for your family to make a healthier supper? And so those are the things that we pride ourselves on. Being an employee partner really just costs your time, and so this can be something as easy as over a lunch break. So being an employee partner means that me or one of my coaches comes in either on a lunch hour or a non-mandatory meeting after work, whenever you guys see fit, and we present on the program and we let your employees know that they can have half off of our program. So that's the basic level of an employee partnership. We can also be more involved, and so with that more involvement, that would mean that I would just have a little bit more involvement with a human resources director or a wellness committee. And so what we do is we keep you updated about your employees on the program. So this is a snapshot, actually for 3M. And so what we do is we send out snapshots annually to your, you can pass that around if you would like, to you guys, and it shows you the average BMI reduction of your employees, how much it's estimated that's saving you for healthcare costs. It also shows you, as you can see on there, 92% of Profile members would actually promote Profile to their friends or family. And so that's something that we send out to you. We also send out newsletters, and so this is where a little bit of engagement from the HR comes from. So every month I would send you a newsletter. So last month it was National Healthy Aging Month. So what I do is I make a presentation. I offer to come on site if you guys want me to, and I can come on site and present. Or it can be something where I send it to the HR director and they just send it to the employee's email, and they can look it over on their own. And so really, it's benefiting you guys by having healthy employees. And it benefits us because we actually have some members that work for Cottington County that are on the plan currently, and it gives that support. So I think about how many people go into a break room and see something that's maybe not the healthiest in a break room. Yeah, sometimes. And so creating a healthy environment is really important for our members that are already on the plan. The reason why I'm here today is I was, one of our members is a Cottington County employee, and she asked me to come present, really interested in becoming an employee partner. So then her friends that work with her, her coworkers, can also have this deal to start. In your folders, you'll see that we have a profile promise. We are so confident in our program that for our members that are coming to 20 coaching appointments, so that's one coaching appointment every other week, though we recommend every week, if they don't see 15% of their body weight reduced in that first 12 months, their second year is free on us. So that just goes to show how confident we are in our program. Do you guys have any questions at all? Are you guys familiar with Profile? You're not?
No.
So kind of new information for you.
So, Mr. Chairman, can I ask a question?
Sure, go.
So as far as how it affects insurance costs, so the employee, what the 50% offer, is there employer involvement in paying for this if somebody decides to do it, or?
Good question. So as involved or not involved as you want. So I have some employers that just agree to be an employee partner to give their members that half off membership. So they're paying $150 for the membership for the year. And then they send out the newsletters that we do every month, and that can be, very minimal involvement, and that's fine. I'm also working with a current employee partner that is going to reimburse their employees $25 when they come to 20 coaching appointments. We have some employers that have paid for memberships in the past, and that's okay. As a coach, I was a coach before I was a manager, so as a coach, I haven't seen that be very effective. If a employer is paying for an entire membership, it kind of takes out a little bit of that incentive to be self-efficient and go to your coaching appointments, of course. So as involved or uninvolved as you really would like to be.
So what is the basic thing that the county has to do to become a partner? Just allow you to come in and speak, do your speak to the employees.
Yes, come
So we
in
would
and
just
speak.
set up a time and date and.
Yes, and I can even do a Zoom appointment as well. So with that, we actually have employee partners out in California, and so all we have to do is a Zoom appointment if that works best. And it's really whatever time works for you guys. If you guys have a normal lunch hour, it can be a mandatory meeting or a not mandatory meeting. It just depends on what you guys see would be beneficial for your employees. I will say a lot of employers will have a mandatory that the employees have to come and, be involved and just hear about it. It's no obligation. So let's say I present to your employees and they decide, hey, it's not for me. That's okay. It's no obligation. And so it's not something where you guys are going to be charged. It's all free for me to come on site and do the presentations.
Any other questions for Brittany?
So, and then does this affect in any way the Sanford insurance premiums, doesn't it?
They're entirely separate.
Okay.
Separate
All right.
entities, I would say, yeah.
Yep.
Just a coincidence on the name.
So the answer is no.
Got it.
Um,
Thank you, Mr. Chairman.
My suggestion is the board just takes action to allow Sanford to come in and speak with employees on a voluntary basis. And then we could set up, depending on how many people want to listen, we could set up a time and place for you to come in.
So you heard a suggestion from...
I would make that motion because
We
I
have a
would,
motion from Commissioner Hatton. Is there a second to that?
I'll second it.
Second by Gable.
I would
Any
not
more
want it
discussion?
to be a mandatory meeting.
I would say voluntary, yeah. Yep.
Any more discussion? Seeing none, and all in favor indicate by saying aye.
Aye.
Both same sign, motion carries. We'll set up a time for you to come in and...
I will
meet
check with employees to see how many are interested, and then we'll figure out where we can hold something. If it'll be in here, if we need a bigger spot, then I've got your contact information here.
Yes.
Okay.
I
All
just
right.
thought of
Thank you.
I thought of a question. So the employee that is currently on the program, will they benefit since it's after the fact? Will they get the discounts or
So
not?
since they provided their human resource information to me for you guys, that we did honor that for them. And we actually have something called an employer, or not employer, but a member referral program. And so anytime a member refers somebody to Profile and they start, they get 4 free products, and then the person starting gets 4 free products as well. And so having your coworkers start, I can think of one instance where somebody came in on site and a couple employees decided to start. Well, the person that initiated that meeting gave everybody an employer or a referral card, and they got 12 boxes of free product, and that's okay. So that's definitely another perk that your employees can take advantage of.
Okay,
Thank you.
thank you.
Yes, you're welcome.
Thank you.
Thank you.
Thank you, Brittany. Notice how they sent this young lady that looks like she's perfectly in shape and speaking to us that are maybe in that top percentage of being overweight, and make us feel real good this morning. So thank you, Brittany, for coming in and sharing with us. All right. Going forward, let's go to monthly reports. Jim, emergency management. And while you're up here, Jim, we're going to take number 6 as well. So when you get ready to shift to number 6, which is emergency management briefing on SLA work plans, and that information is in your packet, and I'm sure everybody's had a chance to read all those questions, and I heard someone say it made you feel glad that Jim was in his position that has to fill this information out. So,
Let's go over that SLA right away, because we're talking about it now.
okay, first thing that you can tell me, as I actually went through that questionnaire, what does SLA stand for?
It stands for State and Local Agreement.
Okay, state and local agreement, all right.
It's the agreement between the state and the county. And by doing what they're asking for in the agreement, the county is given money that's passed down through the state from the federal government to support emergency management with a percentage of our wages and also our expenses. With the state and local agreement, with this, the state, they just keep putting more and more stuff on us. One of the things that I picked up on this year's SLA is going out to the local cities and meeting with them. I just have a problem calling out to the city and saying, would you put me on the agenda? I'd like to talk to you. And then when I get out there, they have to sign a roster for me to attend their meeting, and it's little things like this that are a little bit frustrating with the state. Or I come over here monthly to meet with you, but now I need to have you sign a roster, show them that you were here for this meeting, and whoever else was taking part in the meeting here. So,
Jim, would a copy of the minutes of the meeting suffice for that rather than a roster? Do they want an actual roster?
I'm going to try and do that.
Sure.
And that's one of the reasons that we put it on the agenda to discuss the SLA today. So that'll be in the minutes, and there's also a record of who was here. So that's what we're going to try to get by with. So we don't have to pass the roster around and have everybody sign it. So any questions on the SLA? It points out the things that we need to do. The pre-disaster mitigation plan we're working on. We've got a meeting on that this afternoon at 1:30 over at First District. First District is updating that plan, and by the end of the year here, I hope that plan is going to be signed and approved by the county and the cities within the county, and approved by FEMA. And that's been an ongoing thing, and we have to rewrite that plan every 5 years.
What was the name of that plan?
The pre-disaster mitigation plan.
When is the
This is the form you have to fill out every year. This is an annual form.
That's correct, and we have to sign off, and the chairman of the commission has to sign off on it each quarter during the year. And if we don't comply with the provisions of this, funding can be withheld from the county for our operation.
Well, after reading through this and studying it and rereading it again, it does represent a lot of hours of work, gathering information to fill in the blank.
Mr. Chair, I have a question. The PDM, when is the deadline for that to be approved?
Good question. I'll have to get back to you on the deadline. We do have it set up to where, it'll be completed this year, but I don't know that we have a specific deadline on that where our plan expires. I'll check on that, Commissioner Anton, and I'll give you a call back and let you know.
Sure, thanks.
Mr. Chairman, just a quick question. Are we talking about the plan in detail? Or I can ask, just on...
Any questions on the plan there?
Yeah, just on the communications part, there's a couple of spots where it has expected outcomes. And I'm just, does the state say what those are? Do they write those, or is that something you guys did locally?
No, they write up the plan, and I would say that with some input from out in the emergency management directors in the field, they have a committee that sits down and they discuss this, but the state writes up the plan.
Okay. So I can see some are really good, they're kind of nice objective measures of, effectiveness, hopefully effectiveness, or
Right.
some things that you can measure that you've done, so.
Jim, looking at EMF 6 operational planning, it says develop a civil disturbance plan. Is that currently something that you're working on?
No, that's something that we will be working on, and I didn't bring it up during the summer because everybody's busy, but now over the winter I'll be asking the fire department, the police department, sheriff's department to sit down with me and develop the civil disturbance plan. Okay. And we've got a template that we can follow that the state has put out, so that's one of our objectives for this year.
I think there was a lot of lessons learned up in North Dakota on that.
Right.
So.
You know, and it's not only that, but, you know, it can be a lot of different things. You know, there's a lot of protests these days on a lot of different issues, so
Yeah.
it's a good idea to, you know, develop that plan.
It is kind of broken down though, like I noted here, like operational planning and then communications, and then the last one was crisis communication, and that's expectations for the first quarter, second, third, fourth quarter. So we can kind of break it down a little bit at a time anyway. So.
Right.
Also on the radio communications, it looks like the expected outcome for the first quarter is to program local agency radios, and I know that you're very involved in that. The new radios that are coming out, is that going to affect that at all?
Well,
Because the radio system has to be updated, correct?
the radio system has to be updated, and we'll be replacing some radios. But as far as programming those radios, that will be done, you know, by Sioux Falls Communications or Millbank Communications or whoever happens to, you know, provide the equipment to the agency.
Okay.
I guess my input there, Commissioner Van Dusen, would be to provide the information to the agencies within the county about what's going on and what needs to be done and so forth.
This has nothing to do with the new statewide radio, or is this? Is pushing us in that direction?
This is you know, what the state radio system, what we're going through right now.
Yep.
And we talked about before about whether we should program these old radios and then turn around and have to do it again here in 5 years, or you know, look at starting to replace some of those radios that are more compatible. And that's the route that we're taking right now.
That's for the next gen, I believe, right?
What's that?
The next gen.
Next generation. It's yes, it's the upgrading the system to where we're compliant with federal standards.
It would be a statewide
Right.
radio system, yeah.
Okay, any more questions on the SLA?
Do we need a motion from the board for me to sign this form? Or
Just says it
what do you think?
Once it's filled.
It's not due yet.
Yeah.
You know, it'd be due at the end of this quarter. This operates on a federal fiscal year.
When does this
starting
quarter-
October
yeah.
1st. What's that?
Okay, when does the quarter end? October, November?
December.
Okay, all right. Well, we can wait till then, too.
Sure.
All right. All right, any more questions for Jim? Thank you, Jim.
Okay.
If there's anything we can do, you just let us know, all
Okay.
right?
We'll go into just my monthly report here now. Just a reminder that for those of you that will be attending, tonight is our volunteer appreciation dinner, and that'll be at the Elks Club for those that have called in and advised that you will be attending.
That's at 6:30, correct?
That's correct, 6:30 tonight. On October 3rd, I met with officials from Jenkins. Jenkins is in the process of working on an evacuation plan. So I'll be working with Jenkins and providing information and assistance for them as they write up an evacuation plan. It's just an emergency plan in case something would happen at that facility where they would have to evacuate their patients over there. And along that line, I'm also meeting on the 30th of this month. I am meeting with Prairie Lakes Healthcare System, and they're working on their emergency plan up there. And so myself and representatives from the fire department, police department, will be meeting with them on their emergency response plan up at Prairie Lakes Hospital. Thursday, we'll be having our flu shot clinic. It will be our pod exercise, our appointed dispensing plan exercise. That's out at the Extension Center. And from 2 o'clock to 7 o'clock, we will be administering flu shots for children ages 6 months up to 18 years of age. And these shots are free of charge. So parents, we hope that the parents bring their children out and get that free flu shot.
How have we promoted that?
Through the schools, it's been in the newspaper, the radio station.
I talked to the nurse last night at that meeting, and I asked her, and she said too she wasn't really sure if the word was getting out there. So somehow, if we could get some sort of
Well, we have
I don't
some
know.
media in the crowd here, so there you go. You do have an assignment, gentlemen.
And I do know that there's plans for a couple individuals to go on the local radio stations, talk about it this week. Also, the word has been put out to all the schools, and hopefully the school districts are going to, get that information disseminated to the parents.
It's not like it was last year where they had to bring information in order to get the shot. Now they're able just to come and everybo's able to get them.
Right. And there's a release form, so if a child, say for instance a freshman in high school, if their parent can't be there, the parent can do the paperwork in advance, and that student can come with the paperwork and get the shot without the parent being there. So there's provisions there for that, and that's explained through the school.
And it is held at the extension.
That's being held at the Extension Center from 2 o'clock until 7 on Thursday, October 26th.
And they don't hurt. I got mine done. I didn't even feel it. And they wanted to give me a sucker, but I got a diet candy bar instead.
Diet candy bar.
Yeah.
Some of us need those diet candy bars. Next thing I've got is tomorrow I'll be attending the city department head meeting out at fire station number 2. The trailer that we talked about for the generator that we acquired, that trailer has been ordered, and I'm just hoping, and they assured me that they were going to get it here before the end of the year, so it'll be on this year's budget. But it has been ordered, and it'll be arriving sometime between now and the 1st of January.
Before the first ice storm.
There we hope so.
Yeah.
I will be attending, and you had a travel request that you approved for me, but I will be attending the state IMAT training conference at Pier, and that's this next week. I'll be going in for that. I'll be gone 2 nights, and the state is paying for the meals and the motel rooms on that training there here. And then on November 8th and 9th, myself along with some other county department heads will be attending the state safety conference down in Mitchell. That's on November 8th and 9th. On November 4th and 5th, for those of you that may be taking the Incident Command System training, the ICS 300 class will be offered on November 4th and 5th over at Fire Station number 1. And then again on December 9th and 10th, a month later, ICS 400 will be taught over there at Fire Station number 1.
Do you know what hours they're going to run them from?
It's pretty much 8 to 5 on
Both
each
days.
day. And finally, the last thing I've got here this morning is our next LEPC meeting for those members of the commission that plan to attend. That'll be on November 14th.
All right, anything else for Jim? Any questions? Thank you, Jim. We'll see you this evening.
Thanks, Jim.
Thanks, Jim.
Have a good day.
Yeah, you too.
Next on the agenda is the sheriff, Brad. Brad was on radio yesterday morning and did an excellent job and very informative for a lot of people. Well, thank you.
All right, good morning.
No
Morning, Brad.
tasing experience this morning, right?
No tasing this morning, yeah. Here we go. All right, Lee'll get the TV pulled up here and we'll get started on our, you have the monthly balance sheet on there too? Or?
No, I know, I just
Okay,
hit the,
we'll start with the monthly balance sheet for month of September here. The end of September balance, $10,400. $432.08 in the checking account there. We received $4 in copy fees, collected $8,748.04 in sheriff's fees, $187.61 in executions that were collected, $452.93 miscellaneous accounts, and warrant fees, $450 for a grand total of $9,842.58. Jump to the next.
Fees are up.
What's that?
Copy fees are up.
Copy fees are up, yeah.
You
$4.
probably should
So-
just stop a moment, and I it just ran through my mind when you had executions collected, 187.61.
Yeah.
What did you execute?
Um,
Who did you execute?
well, that's one thing that people oftentimes will hear, executions.
Yeah.
And they, they
Where
think
do
of
you
maybe
do
the-
this?
Good news is that the jail population is down.
That's for executions, for people that don't know what executions are, that's part of the civil process that the sheriff has to deal with. If there's someone sues somebody and they get a judgment against somebody, it's our job to go after and try and collect some fees from somebody. So that's actually what an execution is. So for those of you that are wondering, 'cause
And it has
oftentimes I
nothing,
get that.
has nothing to do with bed
No
count, right?
capital punishment.
Yeah.
Okay.
So
So the jail population is the
Yeah.
same.
the jail population is the same. Yes.
I'm a little
What is the
confused
jail
on that.
population?
Jail population this morning was actually 80, so it's kind of creeping up just a little bit here. But we'll kind of go through some of the stats here for September.
Busy weekend.
And we got it up on the board there. The sheriff's office, we responded to 537 calls and cases and calls in September. 6 accident reports completed. 79 warrants were served. 234 civil papers served. And the transports are down a little bit. There's 3,134 miles on our transports.
How are we coming with the staff? Did you find someone to take over for Chuck?
Yep.
Okay,
Yep. We're sitting good on transport officers right now. And,
good, all right, thank you.
Yep. If we jump on down to the jail activity there, you can see the graphs and charts there. Our average daily population for September was 67.53. You kind of see, kind of dropped down a little bit there into the 60s for most of September, which was kind of a nice little break for jail staff. Our high ADP was 78, and that was on September 2nd. Our low average daily population, the low was on the 25th, and that was 58 people. The 24/7 program on the Scram bracelet, we had 33 people on the bracelet. For twice daily PBTs, we had 55 people. For twice weekly UAs, we had 26. 0 people on the sweat patch. And for bookings, we had 239 people booked into jail. That looks like for a grand total of 114 people on the 24/7 program.
Mr. Chairman, if I could comment on that. One of the things, that's the lowest average that we've had in over a year. But one thing that's interesting about that is that hopefully it means it's going back to kind of that original projection, because you remember in 2015 we hired a consultant with the Justice Advisory Committee, and that was before these spikes that we've had over the past roughly year and a half. And when you add in that spike, then that sends that projection up a little bit, so that 20 years from now you have, say, about, 7 more inmates than you thought you would have 20, 25 years from now. But if this kind of normalizes back to, hopefully that these numbers in the 70s and 80s are a spike in the graph, so to speak. So hopefully, but we'll see. What's the population right now, Sheriff?
End of last week and then into this week so far, we've been at the 80 to 82 around there. So we are starting to pick back up again. So
Spoke too soon.
I actually did average out our average daily population for the first 6 months of 17, so January until July, and we were averaging 84. So hopefully that does drop a little bit, because last year, our whole year average daily population was 73.
Right.
So hopefully it doesn't stay on that trend, and it does kind of slow down a little bit. So you want to scroll down a little bit more there?
Sure.
some of the jail fees collected here. Out-of-county contracts collected $4,179. Work release, once again, that was $4,420. 24/7 fees, $6,697. And then scram fees collected, $5,471. As you can see, they were a little bit less because we had less people in jail.
Quick question.
Jerry?
You've been putting or all the work release people on a bracelet.
Yes.
How is that working out to tracking them?
That's been working really great. Just recently, it was last week or the week before, we actually had somebody that wasn't going to work, even with the bracelet on, so we were able to find him and go get him, so.
Well, I wasn't aware of it, but I mean, I was aware of it, but one of those people stopped by to pick up his tools to go to work.
Yep.
And the officer was there within a matter of minutes.
Yep.
Working
Yeah,
together. And
we
I was
actually
just
stopped
wondering
a few
if
other
all
places before there.
I was just wondering if they, yes, and I'm well aware of where they stop, not through your department, but alternative sources.
Yep.
And I was just curious of how that was working out.
It has been working good, kind of monitor the work release people.
Are we increasing the number of house arrests or not, or how is that working out?
My office, we are not doing any house arrests. Probation has done a few. It works sometimes and sometimes it don't.
Is it a matter of ongoing training?
I don't really know if it'd be necessarily training. I think some of it, just recently there was somebody on house arrest. That was kind of a failure because they were at home drinking and they were partying and sharing pills at a house party.
They were at home.
Yes,
There was another one just recently. There was a juvenile that was on house arrest, cut the bracelet off, and took off running.
Yeah.
Of course,
That's kind of what I mean, I've done a little bit of reading on this. I mean, about the effectiveness of electronic monitoring, and it sounds like it's kind of like what we're saying, that it's questionable and it's on house arrest, but it does enhance things like work release. So it's a good complement to work release to maintain the integrity of that program. But
so some of the issues with that, like I've actually checked with Minnehaha County and Pennington County on some of their stats. Minnehaha wouldn't share their stats with me. Pennington County, I did get their stats from the sergeant that's oversees that program for the work release. What they do is they will actually send a lot of these people out on home confinement, house arrest versus incarcerating them. One of the problems there is they have a 30% failure rate, so that's 1 in 3 people will cut it off and run. The problem with that is you have to have more deputies, more manpower to be able to go out there and find that
Track
person
them down.
and cut the bracelet off, and then you end up having to arrest them for escape, which is another felony charge. Go back in our facility again, starting the process over.
Well, when I meant more training, I didn't mean more training for your staff, but more awareness by the people that are being used. And also, my final question is, do you have anybody that's using both the scram bracelet and the work release bracelet?
It's possible. I can't think of any inmates right now off the top of my head, but that is a possibility that it can happen.
Now,
Thank you.
Just to make it clear that, I mean, these kinds of decisions are not the sheriff's decision. I mean, that would be a decision of a judge whether or not to put somebody on house arrest or to put a scram bracelet and an electronic monitor, and,
Yes.
or 20, to do all. That's the court's decision.
Brad, I had a question.
Sure.
When you go work release, who gets the funds for that? Does the county get that, or how does that, do they pay for that individual? Where does that money go?
That money does go to the county.
I see, okay, thank you.
What does that cost per day, Brad, for the work release bracelet?
$20.
$20?
It's $20 a day for work release right now.
Okay.
And then for the bracelet, off the top of my head, I think $350 is what it costs a day to have the bracelet. So that's built into the $20 work release fees.
Mr. Chairman, just to point out, so in the graph there on the sheriff's report, the work release fee is the light blue in those bar graphs, and the green is the 24/7. And so everything but the black is what's paid for by those different programs, and the black is what the out-of-county.
All right, any more questions for Brad?
It's a good report.
Thank you.
I just got a couple other things here quick.
Yep.
Met with our insurance, South Dakota Public Insurance Alliance came in, did an audit of our policies, procedures. Since we've adopted the 12 high-risk policies, there's 12 high-risk policies that for law enforcement that they kind of suggest that we adopt, and we have adopted those. We've reviewed those with our insurance provider, and since we've adopted those, I'm asking for Myron's permission to go ahead and sign off on our sheet. What that does is that'll actually give the county a 5% break in our insurance. So,
We like those.
yep.
I suppose we better have board action to do that. I'll entertain a motion.
I'll make that motion.
We have a
Second
motion by
that.
Van Dusen, second by Hatton. Any discussion?
Just a quick question. We don't need to agendize that?
Probably not, we're not spending any money.
Okay.
Yeah, we're saving some money. If we were purchasing something or making a major policy decision, then it should be on the agenda.
Okay.
but-
Does this go through our county insurance agents then?
Yep.
Okay.
Well, we're
this
with the South Dakota Public Assurance Alliance, and
This is the
they,
liability.
every time we do something like this, they modify our premium and
Oh,
give us the
okay.
break.
That's good.
So,
Yeah,
Thank you.
it's a liability
but we have a
thing.
motion and a
A
second.
motion, a second, all in
Yep.
favor indicate by saying aye.
Aye.
Opposed, same sign, motion carries. And I signed it already.
I'll get you a copy of
Okay.
that, Cindy.
Thank you. All right,
And-
Brad, what else?
One other update, a couple weeks ago, I'm sure you guys have heard, we had a deputy that was injured in a traffic stop. He is back to work, he's doing a lot better. Just wanted to kind of update the board on his well-being.
I also understand that one of our deputies' father passed away, and be sure and send our condolence to him from the commission.
Yep,
And
will do.
it was quite a surprise, I understand.
Yeah,
So,
the funeral was on Saturday, and we had a good group of deputies show up. So.
Thank you for doing that, appreciate it.
And
Any other comments, questions for Brad? You did a good job on radio yesterday, too, appreciate that.
was the thing at LATI last night, did you
Oh,
attend that?
yes,
Commissioner
that's
Hannon, with
Dan, or the-
with about the opioid thing?
You can talk about that. It was a very good program. I did attend it, and very informative on the opioid.
Last night's Watertown Healthy Youth Coalition, they had a town hall to discuss the opioid abuse, just to kind of make awareness of that. There was a guest speaker that was there, and then a panel of law enforcement, sheriff's office, police department, attorney general was there. We had Deb Hammer from Serenity Hills, and pharmacists. So we had a wide array of people on the panel. A lot of good questions from the public to kind of make awareness of this. It was kind of the kickoff for the Stand Up project, and that's where you can text to get to send anonymous text on drug information. If you have any drug tips or anything like that, it's pretty easy. All you got to do is text drugs to 82257. The police department is involved with that. The sheriff's office is involved with that. What you do is it's completely anonymous. You go ahead and text drugs to that. It'll ask you a series of questions. They're all anonymous. I do not know about it. The police department doesn't know who they came from, but it'll ask you questions of where, who, and you just be as honest as you can and answer as much as you can. It forwards that information to the proper agency, depending on where it's at, and it can be investigated.
So that's about any kind of a drug issue, not just opioids, prescription.
No.
Any sort of drug information.
If you have suspicions of a neighbor or suspicious things happening in your neighborhood, that's an opportunity that you're able to, because most people are afraid, if they say something on the neighbor, then they'll do something back to them. So it's a way of...
One other good spot is the sheriff's office on our website. We have a tip line. There's a lot more people starting to use that. You can go to our website and then click on tips. It'll shoot an email out to the deputies. You can be anonymous on that as well, so you don't have to put your information in there. It goes through the server somehow, computer stuff.
That's the big thing that people need to know, is that this is truly anonymous, so don't hesitate to use it. Your information will not be collected in any way, so we've
And
seen
these
those come through.
programs, to follow in on Commissioner Van Dusen, is important for more people to understand that we do have a problem. And the problem isn't just unique to Watertown, South Dakota. It's statewide, and the more awareness that we have in reference to this, the better off we are too.
Judge-
One of those things when you talk about opiate abuse, a lot of times you'll maybe have at home, somebody had surgery, something like that, and they may have some prescription painkillers or something at home. Everybody probably knows somebody that maybe their wife had surgery a while ago, they got these sitting in a cabinet. Maybe the person comes home, they have a sore back or a sore neck or something like that. Well, maybe instead of going to the doctor, I'll just take one of my wife's or somebody else's pain pills and just get me through this. I mean, technically, you just committed a felony by taking someone else's prescription.
Yeah.
I'm sure everybody can probably think of somebody off the top of their head. So.
And
And there is a drug take-back box in the lobby of the sheriff's office for those types of
Yes.
situations that people can drop off their medication.
the police department is doing one, is it this
The
week,
Saturday.
Saturday?
There's one this Saturday
Yeah.
from 10 a.m. to 2 p.m. You can go ahead and bring them, drop them off there. Otherwise, the sheriff's office, we have a drug take-back box, which is in our lobby. It's up year-round, open during business hours. So feel free to drop them off. It's a good thing to get rid of them. If you're not using them, get them out of the house.
Judge
I
Means was on panel also, and she talked about Hope Court. That's something we don't have here yet in Cottington, but maybe is something that might happen down the road.
Yeah.
Which court was that?
Hope
Hope
Court?
Court, okay. No, I think it's great these sessions are being held. We do have a drug problem in this region, and I think throughout the country now. And it's not only, it used to be marijuana. When you'd stop a vehicle, it wasn't uncommon to get marijuana out of a vehicle, and now it's methamphetamine. And so it's becoming a bigger, I think it's a crisis in our country. So it's good that these panel discussions are being held. The big part of that is public education and getting parents and the public out to recognize when they see this stuff, what it is exactly. So I think it's good. Good job. Thank you.
The thing that I also came away with that I didn't really realize, some of these are on opioids, but after a while it becomes hard to get that, so then heroin is their next drug of choice because it's easier and less expensive to get into use. So unfortunately, these are measures that they take. Also, another place that you might find some information that Marty Jackley mentioned last night was nomethEver.com. To go on there and you can research some things on there. So, anyway, it was
Okay.
very good.
Anything else? Chuck, Charlie, we're, okay, thank you,
Your
Brad.
deputy did a good job the other night in the pursuit.
Yeah.
Good. All right, thanks.
Have a good day.
Thank you, Brad.
All right, next on the agenda is a discussion possible action regarding a lease agreement on property to be taken by tax deed proceedings. That's Ann. And with that, Ann, you go ahead and fill the commission in on your findings and
Sure.
requests.
What I've got is, a week or so ago, I took a piece of property over in Henry Village. That's one, that is not going to be rented out. If you want to look at some pictures, Cindy has some of those for later, but the condition of that house is not livable at this time. I contacted the city finance officer over in Henry to let her know that we were taking it, just to make sure there's no snow removal issues or lawn issues or mowing issues, that type of thing. She had indicated that the house was not livable. Brad sent one of his guys over to take a look at it after we'd taken deed, and it looked like people were partying in it. So the folks from the maintenance department went over last week, and they boarded it all up. It's on our it's covered by liability. I don't think, one of the things I was going to ask the board is if you thought that property insurance on there was a good idea. I'm not sure you want to spend the money on that, given that the city thinks it should be torn down. There might be a better judge of condition than I would be, but so on that one, I guess my question would be whether we would want to have property coverage added for that one, or my recommendation is that the liability coverage is enough. But,
How many lots is and what's the value of the property?
say that again.
How many lots does
It's-
that consist of, and then what is the value of it?
It's a lot and a half. The taxable value that I have on that one is about $37,000. 37,564 is what I have.
That's including,
Record number is 4851.
that's including the buildings though, right?
Right, it looks like it, if I remember the pictures right, it's got a building and maybe a garage and then a little shed on it.
Okay.
I did have a chance to visit with Ann in reference to these properties, and I concurred with Ann in that I think we need to maintain the liability insurance on it, but the value of the property, the buildings, is nothing really, and I think it would be maybe not worth the insurance to get property damage on it. So that was, I agreed with Ann and her
Carol.
recommendation, or Carol. What did I say, Ann?
And I didn't know.
It's
if you went
almost
to the
like talking to a
registry of
family
deeds.
member. That's just the way it is. I know who you're
That
talking to.
liability
I would
insurance
agree.
covers anybody coming onto the property
Right.
that shouldn't be there and gets injured or anything
And
like
the
that.
liability will
Protects the
take care of
county.
that.
I would,
Okay.
can I make that motion, or do we need to have a
Second.
motion that?
We have a motion by Hanton to
Just
maintain the
cover it with
liability
liability insurance only.
insurance, and a second by Commissioner Waterman. Is there any more discussion?
Just a quick question. What's the premium on that kind of insurance roughly? Pretty,
I think it's pretty nominal,
okay. Sorry.
but she wasn't able to get me a bid in time for the meeting.
It'd be a lot more to have somebody get hurt on it.
I'm
Yeah.
just curious.
Exactly.
The liability as soon as, the liability is in place as soon as it's deeded to the county.
Okay.
I did talk to the risk
It's
management
automatic
people.
on our,
Yes.
with our policy. The liability insurance is carried by South Dakota Public Assurance Alliance. Our property insurance is with Fisher Rounds. So we would have two different, two different carriers involved if we put general property insurance
So,
on this one.
but it's covered, but there'd be some effect on the premium when they're with the,
No,
Public
it's
insurance?
it's
It's all
covered under
covered.
our general
Okay,
liability.
okay,
Yeah,
great,
it's
yeah.
under that, so there's no.
okay.
Just have to.
All right, we have a
that.
motion and a second on the floor. Is everybody clear what we're voting on? All in favor indicate by saying aye.
Aye.
Opposed, same sign, motion carries. All right, another property that we have?
Okay, the other one is a property that we're scheduled to take tax deed on. It currently has a tenant in there. He was buying the property on a contract for deed. As a part of the contract for deed, his understanding was that the seller was supposed to be escrowing for taxes and taking care of that. He was unaware of that, and then when I had him served, it did catch him by a bit of a surprise. What I visited with him about it, asked him if we do take deed to the property, if he and his family would be interested in staying on as a tenant. He is interested in that. Then the question became, what would the rent be? Currently, under his contract for deed, he was paying a $300 a month payment. I did ask a local realtor about what potential rental fees might be. She had given me an estimate about $600 to $700, but she said without seeing it, she couldn't really be sure. $600 to $700 seems a little more likely for Watertown for rent than it would necessarily for Florence. I could be off base, but if you'd like to, we could have her take another look.
I have a question. So what is the amount of the back taxes? If he didn't realize they weren't being paid, because he entered into a contract for deed with the homeowner at the time, so I don't know how many years that was supposed to be for. But anyway, yeah, what would be the back taxes?
I didn't bring that with me, but it's a little over $1,100 a year for 4 years. I'm guessing it's about $6,000 is my guess. Off the top of my head, I should have grabbed my other list, but I did not.
You need a property number?
Because
You got it, okay.
his intent was to purchase the property.
His intent was to purchase the property, right?
Carol,
But
will
the-
we need to put insurance on that one then? If we're,
If we enter into the agreement, based on the last one we took, when we leased out the property, we add it to our coverage, and yet he has to maintain a leasing person's insurance.
Renter's insurance.
There you go,
Yeah.
renter's insurance. Sorry, couldn't come up with it. He has to maintain a renter's insurance as a part of the contract. I talked to him about it. He already has insurance on it as a homeowner. He already has coverage. So changing the policy, my take from our conversation was that wouldn't be that big of a deal. So I guess the question is more having to do with what the rent might be if and when I actually do take deed to it. I haven't taken deed to it yet because I don't want that in between where we sort of own it, and yet we've got people in there and we don't have anything covering anybody. So I'd sort of like to get our ducks in a row first, which is why I'm coming to the board.
Mr. Chairman, just a question.
Yes.
So are you seeing the rent as covering the back taxes or?
The rent is separate and apart from the taxes.
Okay.
Because of the value of this property, you are going to have to offer it at public auction. There won't be a situation where you can do a direct sale to him. Because of the value, it has to be set. And usually, practice is, historically, we always hold ours for at least 6 months. And that's to allow any creditors or anybody that, if there was a failure in the service, a chance to
Redeem.
have my tax deed rejected and redeem the certificate.
So he's not
Carol and
able,
I had an opportunity to visit about this property, not Ann, but Carol. Carol and I did visit with this, and a couple of things that everyone should be aware of is that this individual is paying $300 a month and has been current, has not been delinquent, has been paying that rent. And our understanding is that he wanted maybe to negotiate a different rental amount, lower, not higher. I don't know if that we should go that direction because he has been current with the $300, so apparently has been able to do that. He may have a change in his family situation. We don't know for sure, but just in our discussion, we thought rather than have it fall back on us, why not let him continue to live there, draw up a rental agreement, and Tom Burns would do that for us. And in that agreement, let him understand that in 6 months, this rental agreement would be for 6 months, and at the end of 6 months, that this property will be sold. So it'll get us off our books, and he'll have an opportunity in that 6 months to make arrangements with the bank, and he may be able to purchase this property and have a lower monthly payment than his rent payment, the way things are right now.
I have a question. Since he's been in the process of purchasing it, he is not able to pay up the back taxes and then be able to redeem it since we took it on tax deed? Or in the process of it?
Well, conceivably, he could do that. I guess what the problem with him doing that is being able to get clear title
Because
under
he's
the
in-
contract.
in-
Because we weren't the only ones in line. The other deal is there had been a death in the family as far as who owned that property, so they're going to have to probably
Probate it.
right. So I'm just thinking that there are other issues that will keep him from being able to get clear title, such
Because-
as throwing good
Right.
money after bad.
Yeah.
Because in other counties, we don't have that happening here, but there are other individuals who, when they know there's a property that's back or not paying their taxes, they'll start picking up those certificates all those years, so when the time comes and they've got that done.
Right. In those instances, the counties sell the certificate, and then those buyers are stepping into the same
Yep.
our same shoes. Problem is, we don't
do that.
Right. We don't sell the certificates.
Yeah, which is fine, but I'm just saying, yeah.
Right.
Cindy has some numbers over here she's looking at.
Oh, I just tallied up the delinquent taxes at $8,311.01.
That's back taxes.
From
What is the valuation on this property? Do we know?
Yeah.
Cindy will have it in a minute here.
It is, let's look at this year's, look at the taxable, just for the heck of it.
Taxable 67,426.
Is it? Okay.
No, I've got 71,848.
For taxable or for
Taxable.
assessed?
I've got 71,848 for taxable, pay 2018, on record number 954.
Right, I'm looking at 16 to 17.
Okay.
I don't have
Yep.
17 to
All right,
18. Sorry.
taxable for pay 2018 is $71,848.
So there is some equity in the
Right.
property.
Yes.
Yep.
Yeah.
Well, I guess I would make the motion to continue on with his, to enter into a lease agreement and continue with the $300 payment until the 6-month period is up, with him realizing then that unfortunately will have to be put up for auction because of the value.
Second.
We have a motion, a second, any discussion? And that 6 months will give them a deadline, so if he goes and talks to the banker, everybody will understand that in 6 months, something has to happen.
Yeah.
And should give them plenty of time.
Just
Is that
to-
a-
Go ahead.
Go ahead, Brenda.
For Carol, for what you were coming, is that kind of the direction that you were looking for? Is that
Yes.
satisfactory
Because
for
because I just sort of needed to
be able to
come
tell
up
him?
with some numbers to talk to Tom and talk to the gentleman that's in the house.
And renter's agreement is
So-
also, or renter's insurance is also a part of that agreement that he's.
Yes.
But generally, that's just for the
Personal property.
personal property that's in it. We will need to cover it for.
Yes, we'll have to add it to our
For
The only
property.
thing, the only addition that I'd add is to have Tom verify that he actually does have insurance.
Right.
Yeah.
As a part of the other agreement, they had to provide us with a copy of their certificate of insurance
Right.
showing that it was in place.
Right.
All right, any more questions?
Unfortunate situation, no question.
Yeah,
But
that.
I hate to penalize the guy if he didn't know that taxes were due on the property.
I know. Yes, Charlie?
Yes, this one is in Florence, yes.
All right, any other questions, any comments? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed, same sign. Motion
Well,
carries.
actually, is it in Florence or Fuller Township?
It's in,
It
is in Fuller
It's in
Township,
Fuller Township.
just outside
Just
of,
outside of Florence,
right.
yeah.
It has an
Okay.
actual street address in
Yeah,
Florence.
that's right.
The suburbs of Florence.
Yes.
Yes.
All right,
Thank you very much.
thank you, Carol. Sorry I called you Ann.
No big deal.
Oh, I have one more question. So when will this other one, the Henry lot, when will we put that on for public auction? Is that 6 months down the road also?
That'll probably be next summer, yes.
Okay.
My idea would be that I would get these all together and lined up and have the auction. So it's going to vary because I have a few more that I'm still taking that
Oh,
are,
okay.
they're land only. There's, they're just footages out in Kransburg. I have 2 pieces over there. We had to do tax deed a little differently on that. I was unable to notify all the beneficiaries or the descendants of
Heirs.
Yes, there you go. And so we had to go to court on that and do a different publication. And then another one I'm taking to, my 60 days expires November 15th, just because, again, I couldn't locate property owners, so.
It may seem like there's quite a few of them all of a sudden, but actually, I think what's happening here is Carol's trying to clear up some of the books.
Right.
And
Every
that's
year,
what
yeah.
we
Right.
talked about before. Let's get this stuff taken care of and get the papers off the desk.
Right,
So-
they're little footages, basically, that are
Yeah.
causing the issue, and people have walked away.
Right. So we'll be having that come up before us the next while here in November, the other ones that you plan on taking.
Yes,
Okay.
and my thinking is, if I'm getting the conversation right here, there's no property, these are just land. There won't be any property issues, it'll just be the liability insurance, and there won't be really anything more for you guys to know other than
Right.
I've taken them, so.
Yep.
Dirt.
All right, thank you.
Sounds good. Thanks, Carol.
Thanks, Carol.
Thank you, Carol. All right, number 8, let's go on. Action to renew Reliance Standard Employee Life Insurance Premium. And there's a insert in your packet in reference to that. And this is actually the notification that there will be an increase in costs. Is that right? Or
Yeah.
decrease?
No, actually, it's an increase. Currently, the current rate is 16 cents.
Go to 7.
They wanted to raise it to 18 cents, but Risty Benefits talked them into lowering it to 17 cents. So this is for the general life and AD&D that the county carries on each employee. It's a $25,000 policy, so it would be going from $4.63 per employee to $4.64 if you want to renew this policy.
And does that include the commissioners? Are we on that policy?
I don't believe you are on this
We
policy.
are not on that policy. I'll make a motion to renew this
Second.
life
Motion.
insurance premium.
Second.
Second by Gable. Motion by Hatton. Any discussion? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed, same sign. Motion carries. Let's go on to number 9, no meeting on October 31st. That's a week from today, since it's the 5th Tuesday of the month. We're going to give Cindy and the crew a break. Then also number 10, note on Thanksgiving and Christmas closures per governor's office. I think there was an email that was distributed to all directors. Did you get that?
Yes.
And
Yes.
In the past, we've always followed our schedule with what the governor's office has recommended. You want to just give us a breakdown of that quickly
Yeah.
for the press so they know?
The county's policy, as adopted in the personnel, is to follow the days that are given off by the governor. The governor is giving administrative leave to all state employees on the day after Thanksgiving, which would be November 24th, and he's also granting administrative leave the day after Christmas, which is December 26th. So per the county's policy, we follow what the state does. We will be closed those days.
Any questions?
So we'll have a different meeting date in December.
Which will probably work out better anyway if we could meet
usually do
on
anyways,
Wednesday
move
or
it.
Thursday
Yeah.
closer to the end of the year too. So you guys will have to decide
Which day?
Wednesday or Thursday.
Which day works better for you, or which day? would
It
you-
doesn't matter. No, it'll be fine
Okay.
with me.
All right. Any more questions in reference to that? It was primarily for information only.
Yep.
Number 11, action to approve claims for payment. Do we have claims?
We have a few claims.
All
There
right.
are
I think there's 3 of them here.
credit card payments and our 911 surcharge to the city of Watertown, which is under the new contract where we pay out 100% of the surcharge collection. So the first bill is to Visa Reliabank. It's for the auditor and treasurer, $506.93. Those were our travel costs for the convention in Pierre. The treasurer is the only one that had a hotel room because mine was comped being the president of the association this year, so that saved the county some money. Visa Reliabank, the second claim is $143.08, and that's for the emergency management department for travel and supplies. And then the 911 surcharge collection, these are the August collections. We paid out the entire amount of $22,692.78 to the city of Watertown.
I'll make a motion to approve.
We have a
the claims
motion
payment.
by Van Duzen, second by Lee Gable. Any discussion? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed, same sign, motion carries. Any budget supplements?
I have nothing for 12, 13, or 14 this week.
Looking good. Old business to bring before the commission.
Mr.
Yes.
Chairman, couple things. So last week, we approved the agreement which you signed with BKB Architects. On our next meeting, since we're not meeting next week, that's 2 weeks from now, so November 7th, the architect Bruce Schwartzman will be in town. We also have a CCJAC meeting that evening, so that's November 7th. So that's when he's going to get started meeting, I guess continue the process of meeting with the actual users of the space, the judges, the clerk of courts, also probably fire inspector, and hopefully a discussion with the Historical Preservation Office as well. Possibly he may be able to brief us in the commission meeting just to give an idea of an overview of the process. And that this is about renovating for the second courtroom in the clerk of court space. And then on one of the aspects that people will recall is moving the nurse's office out of the building. So continuing to look at rental properties. I think we're down to a couple good ones in the downtown area. So I'm in discussion with the Department of Health because they have to, and the nurses, so to see what space will satisfy their needs. And the rent prices look like they'll be about what we budgeted. So
Good.
so.
Anything else?
Is this on
For
old
old
business?
business. Anything else for old business? How about new business?
All right, so for possible times that there could be a quorum of commissioners tonight at the Volunteer Appreciation Dinner at the Elks at 6:30. Also, there is a welcome this afternoon from 4 to 6 at the Salvation Army for the new lieutenant, I believe. I don't know how to say their name. Zach and Carissa Zumwalt, something like that. Anyways, from 4 to 6, there is that going on. And goodness, I gotta try to remember for 2 weeks. Make-A-Wish is next Friday, November 3rd. There could possibly be a quorum of commissioners at that event. I'll be taking the ICS 300 class. I don't know if anyone else is, if there's going to be a quorum as something like that.
Already
I
done.
thought we had all the. Is ICS 300? Is that when you're supposed to renew or?
No, I just
take
need
it
that
to
one.
one time.
Oh, I think I.
Nope, they're all just a
Check.
one-time
Okay,
thing,
check
and
that one.
that's the last one that I have, and then I've got mine completed also, so. That's all that I have, that there could be a quorum of commissioners unless somebody else sees something that, or knows.
All right,
Yes,
anything
Mr.
else for new?
Mr. Chairman, this is not really a quorum, but as you might remember, the Juvenile Detention Alternative Initiative. So I went to a meeting, started with that meeting in Orlando, then one in Sioux Falls. And so we're starting to get that together, similar to the mental health initiative and the Stepping Up initiative for the jail. This is about reducing juvenile incarceration. And so we're having a kickoff meeting on Thursday, and that's kind of being led more by the UJS than by the county, but the community is kind of participants. So it's kind of a smaller meeting, but Judge Means is going to host that in her chambers on the 26th. It's not really meant to be a big meeting, so that's just kind of getting it together. I think eventually the group involved could be pretty large, like it was for the mental health session that we had before. So just for everybody's information, that's going to be happening Thursday.
Also this afternoon for that Cottington County PDM plan, there maybe could be a quorum of us at that as well at 1:30.
All right, anything else?
Thursday.
Not that I can see.
That pretty well takes care of new business and the open, I think, doesn't it? Anything for the open?
Oh, that was the open, I'm sorry.
Anything
I
for
guess I
the,
don't
anything
have
else
it.
for the open? All right, seeing none, then I do have 2 requests for executive session. One is in reference to updates on union contracts, and the other one was, what was the second one?
Litigation.
Litigation.
Yeah.
I'll make a motion that we go into executive session.
Second.
State's Attorney. We have a motion by Hatton, second by Van Duzen. We are in executive session.
You got to vote, don't you?
Vote.
All in favor indicate by saying aye.
Aye.
And will there be any action as a result of the executive session? Anybody know?
No action.
No, okay.